Hello and good morning. This is Dr. Suleiman Lalani. I'm a practicing primary care and geriatrician in Sugar Land area. This pandemic of COVID-19 is affecting all of us. We are seeing the healthcare crisis along with its socioeconomic consequences. Everybody is going through something or the other. We are hearing a lot of numbers and so many hundreds of people are being affected, but I want to tell you today that as of now, about 500,000 people have been recovered globally and almost about 30,000 people in USA. So there is a light at the end of the tunnel. Today's topic, I would like to focus on its impact on children. We are blessed that I have a good colleague, Dr. Hasnain, with us, who is an area pediatrician. He is a physician leader with servant heart, very well known and upfront in community service and philanthropy, been in practice for over 20 years. Good day, Dr. Shahid.
Good day. Good morning. How are you, sir?
I'm doing very well. Thank you so much for joining us today.
Absolutely my pleasure. I feel privileged to be here talking to you, and I'm glad you gave me a chance. So basically, I am going to start by using this word lockdown. We have heard it many, many times over the last few weeks and months, and it's a major word. It has huge impact. It is not only physical lockdown, but more of a mental lockdown. And the mental aspect, unfortunately, we are ignoring it, or maybe we are not aware about it. So I am more concerned about the mental lockdown as compared to physical lockdown. And so I want to see what you think about this lockdown.
I think let's start with, let's break it down. Tell me a few things what I'm hearing. One is that children may just be carrying it and don't get symptoms. They may be just the vectors and then they spread the disease. I also hear that there's some mild symptom that comes to that. So let's break it down and say what are the physical symptoms that a parent should look into, or what would you see? And then we'll come to mental.
Right. That makes sense. First, I would like to start with numbers. There has been an incidence of only 1.7% in the pediatric population. And fortunately, the ones who get affected, the majority of them don't manifest any sign or symptoms. So they will be totally asymptomatic, but they will be having virus. So due to this situation, it's very hard to diagnose. But we have to assume that, yes, some of them do have the virus. So we have to take care of them just like we take care of adults.
But we are not going to test them. If they are not showing any symptoms, we'll say, okay, stay at home.
Yes, absolutely. We will just manage symptomatically. We'll use our common sense, provide nursing care to them. But definitely we'll keep our guards up that if there's a spike of fever or any other major sign or symptoms, then we'll provide them proper medical care.
What sign and symptoms a parent should be aware of?
Actually, it's a long list starting
maybe
from
what, 3 or 4 major?
Yeah, fever, cold-like symptoms. Mostly they will present just like cold-like symptoms, like common cold we see, flu-like symptoms. They can also show up in our clinics with diarrhea and vomiting. But some of the rare symptoms could be sputum production, there could be sore throat. So it's pretty misguiding. You cannot stick to any one sign or symptom. So it's a big
challenge. In short, just call the provider, talk to the doctor if you see anything different in your child.
Yes.
And at that point, you can have your medical doctor will make the decision along with the parent that is this something to be treated at home? Is it something to be worried about? Or is it something to be brought and further testing is needed?
Exactly. And what is more important that in history taking, we always inquire, is there any definite exposure or not? Let's say if there are 2 adult members in the household who are positive, then obviously our suspicion will be very high in that particular case. But if they have not been exposed, then we'll be less worried.
Okay. So fever, cough, some shortness of breath, some allergy-like symptoms, some upper respiratory type symptoms, but you have also seen somebody showing up with GI symptoms, nausea, diarrhea, and things like that. So parents should be calling.
Yeah. And one point which comes to my mind at this stage is that if you can afford to keep a small gadget known as pulse oximeter, Basically, you put this gadget on your finger and you can measure the oxygen in the blood. So it's a very good marker you can use as a basic screening test. You can buy it from Amazon or any other place. The price is only $18. So I would highly encourage myself and all others who are viewing this program to go ahead and buy it. You can use it for adults and children both. So this gives a status of your lung function. It's a very good reflection where your lungs stand. As we know, most of the cases of COVID-19 will have lung issues, either in the beginning or down the road. So go ahead and buy pulse oximeter.
So now coming to the mental health side, of course, the children are also stressful and they will show their emotions in a different way. I've seen children clinging to the parents. I've seen children misbehaving or becoming stubborn.
Yes.
They're fighting among their siblings, or they are more needy. They just show up. You just have fed them a breakfast. In 10 minutes, they again come up. I'm hungry, or I want thirsty, or I want this. So this could not be just the hunger, but that may be the needy behavior that they're coming up. So talk about something about what the mental symptoms that you're talking about of the lockdown.
Sure. So we can divide it into three parts. The manifestation or symptoms are going to be different depending on the age. If it is elementary school child, it's going to be pretty different compared to an adolescent. So let's say you have a 4-year-old child who's completely potty trained 2 years ago. You may see that now this child is having stool accidents and urine accidents or both. Some of them can revert back to thumb sucking. So in psychology, we call it a regression. So basically, you have gone to the previous milestones. That's one marker. We can be alert about that. They can start crying excessively. Little children could be very fussy. They can lose their appetite. And like you said, they can start clinging to you more. Now, let's come to adolescents. It's a different ball game. In adolescence, we can see acting out. They can be aggressive, they can be screaming, they can be agitated, they can lock down themselves in their rooms. So those are some of the symptoms. And now, since we are talking about adolescents, I would encourage myself and all of the parents to encourage their children not to stay in their bedroom. Please don't stay in the bedroom. Stay in the family area. We have to know that bedrooms are for sleeping, especially during this lockdown period. The more we can stay in the family area, the more therapeutic it is going to be. Because when we are alone, negative thoughts can victimize us, and we don't want to be victimized by negative thoughts. So
that was my another follow-up question coming, that people come to home. This is our nest. This is somewhere we come to relax. And now adults have to do work, so they may be doing online work, Zoom meetings, and whatever they need to do, prepare for their work. Teachers are teaching online, so students have to go to school online. So all of a sudden, something which was a fun area, happening area, became a very disciplined area,
yeah.
and then everybody's going through their stress, right? So you're going to say something about how they should manage that?
Right. Yeah. Right. One very important point is that we as adults should pay attention to accommodating the children's need instead of expecting them to accommodate our needs. So in other words, we have to visit their page instead of expecting them to visit our page. So obviously we have to pay sacrifices and see what their needs are, what makes them happier, and obviously make fine changes accordingly. And that will help the entire family. I'm not going to have an argument with my child. Try to understand what they are saying and what their comfort zone is. Obviously, it's not difficult to accommodate their needs. So let's make fine adjustment and changes accordingly.
Excellent. And being a geriatrician, I'm going to plug in my line. So we need to treat our elderly parents in the same way too. They're going through their emotions.
Exactly. Yeah. Yeah. So
Excellent.
It's very important to understand the emotions and feelings of children, which we fail as adults most of the time, unfortunately.
So what you're saying is pre-plan the activities, make sure the expectations are set up or expectations are not that high.
Yeah,
Sometimes failures will happen.
yeah,
Sometimes, so you don't expect that everything needs to be A plus perfect.
yeah, exactly. And there's basically three major important points I would like to share with the viewers and with you as well. That number one is stay calm. Number two is listen, listen, and listen. And number three is provide reassurance. If we can take care of these 3 points, then we are the winners. So pay special attention to these three aspects.
Tell me a little bit about how can we be more safe or create a safer environment at home. It could be activity related. For example, um, something that comes to mind is if you have a toddler in the house, so make sure you have your toys or sandwiches or something or juice that you have kept it to their level, so they're not jumping on the stool or getting on the chair to pick it, and there's a chance of fall.
Right.
So how are those safety measures we should look into for our children in the
So
house?
the word which comes to my mind is child proofing. Okay. So you have to think little bit beyond imagination that what are the chances that my 4-year-old can get hurt with?
Hmm.
Is it height? Is it the stove? Is it the iron curler of my wife? So in our clinic, we see up to 4 injuries every single week. So obviously, when we are confined inside the house, the chances of injuries goes up multiple folds, multiple folds. Yeah, we are all compact, we are all crowded, we are fussy, we are agitated, we are grouchy. So our actions are not going to be very, very reasonable. We are all going to make mistakes, we are going to make blunders. So we have to accommodate that in our mind that those are the possibilities. So our defense mechanism has to be modified accordingly. And ultimately, the entire responsibility falls on our shoulders, the adults. If we can prove as role models, as good mentors, then the home environment would certainly be better. And I
Excellent.
mean, yeah,
So we have to be conscious about our behavior, what we
exactly.
are doing.
In
Tell
fact,
me, there is also a point of what we hear that domestic violence, child abuse cases are going up, and how do we prevent or protect our children from that?
yeah, I'm so glad you brought up this word, child abuse or domestic violence. In China, in the month of February, the domestic violence incidents tripled. Okay. So that is a strong message for us that if it has hit China, it is certainly going to hit us, just like the COVID-19 virus. So historically speaking, anytime there's a natural disaster, there'll be a rise in domestic violence. If you recall that after Katrina, we saw a very big rise in domestic violence. You will also recall that after 2008 recession, we saw a big jump in domestic violence. And most of the time, domestic violence and child abuse go hand in hand. As
And
you know, most of the,
tell me also that domestic violence or child abuse just cannot be physical, it can be mental too.
in fact, it is more of mental, less of physical. Yeah. Verbal abuse, emotional abuse is more than physical abuse. And the tragedy is that it is all invisible. And since it is invisible, so we don't identify it, we don't report it, we don't become aware of it. And it has long-term consequences, it has short-term consequences, and it could become a permanent scar in your lifetime. And it is said that if you have been abused as a child, the chances are that you'll be an abuser as an adult. So it goes in a circle, it goes in a cycle. It is a major thing. We have to be careful. And especially during this time, lockdown time, we are at very high risk. And we know that adults are more vulnerable to burnt out. And especially now that they're working from home, they are not mentally ready, they're not physically ready to do so. These are all ad hoc arrangements we are into. So we have a lot on our shoulder to perform.
Yes, so that's where the word conscious behavior comes. So
Yeah,
we may think that we are doing right, but
yeah,
sometimes our tone would be such. Sometimes we are in stress. Financial stress can worry adult out, but that emotion can be played, and child can pick up that emotion, and that
yes, yes.
sense of insecurity would come.
Yeah, and children always look up to adults. So that's the reason earlier I was saying we have to remain calm, very calm, and we have to act as role models. Most of the time, they will copy us. And it is said that depressive symptoms are very contagious. The children will copy us. If I'm depressed, the chances are my children will be depressed, my spouse will be depressed. So I have to work on myself first and keep an eye on my children. And one more a good method, in my view, is that from time to time, I may like to ask my children, how are you feeling? Do you want me to handle things differently? And most of the time, the communication is good between adults and children. So they will speak up. They'll say, you know what, you have been mean to us. And if they say the sentence, I have to believe them. And obviously, after that, I have to make changes accordingly. I cannot let it remain unchecked. I have to be accountable for my behavior, my performance.
So
So
this is a very good point you bring in, that be proactive, talk with your child,
yeah,
ask them what are they going through, what are their stressors are. Maybe we
yeah,
think something and there is something different. So it's good to talk
yeah,
about.
yeah,
There may be accommodation that they had their. Uh, I would give my son's example. I was talking to him that he's home from college. What he feels differently that has happened. He said, "I have my study place at library to go to read, and I find different now." So
yeah,
he's trying to accommodate and finding a space at the house, which will be his study place. So
right.
you're right that we need to be proactive, asking children that what are their stressors and how they are coping with that. Coming
Yeah.
back to another point, what could be the activities a parent should do or can do with their child, since they are not able to go out to movies, they are not able to go out to outdoor things at home, which could be more productive, not just
Yeah.
killing time with their child, but to be more productive.
Yeah. So basically, it is a joint venture. Okay. And the entire family is one boat in one boat. And we call this coping mechanisms. And coping mechanism not only for children, but for adults too. So one thing I'm going to recommend very politely and very strongly is that limit watching the news. Limit watching the news. Most of us are sitting in front of the TV listening to the same news. And we know that what media does, it gives us two things. It gives us news and it gives us sensations. Because without sensations, they cannot sell the news. Unfortunately, this sensation causes a negative reaction in our mindset, and that does hurt us. So, I would encourage myself and the viewers to watch the news twice a day, just morning and evening. That's more than enough. We need to know, and spend rest of the time with the family members and remaining proactive, be productive, whatever profession I'm involved, think in that direction, walk in that direction, because our children are watching. Sitting in front of the TV is not healthy. It is nothing positive. I'm not going to call this positive. Second thing is that try to do some fun activity like play board game, indoor games. And there are many apps you can use on the phone which will provide you happiness. You can do it for yourself, for your family. Now, there is some little bit myth about lockdown. I'm going to bring it here. Lockdown doesn't mean that you just remain inside and lock your doors. Feel free to use your deck. Feel free to use your backyard. Feel free to use your porch. Feel free to use your courtyard. I mean, it's not radiation that if I go in my front yard or backyard, the radiation is going to kill me. No, it's not like that. Mental well being is extremely important. And mental illness is more common than common cold in this time when we are surrounded by this pandemic. So in routine days, they said that mental illness is as common cold. And now that we are in the pandemic era, this is more common. So please visit a little bit of outdoor, do some little bit outdoor activities. And if you are uncomfortable, put on a mask. That's one suggestion I'm going to recommend. Next, I'm going to recommend is do virtual socialization. These days, almost all of us have access to laptops, desktops, iPhone. We can talk to our friends on Skype, FaceTime, and other vehicles, other platforms. That's very nourishing and nurturing. Spend some time, have some laughters. Laughter is a tonic, we know that. So that's going to be quite therapeutic. Besides that, you can do some meditation if you believe in that. You can do some prayers. That will have a soothing effect on your mind and body both. So I'm going to encourage myself and my viewers to consider meditation and prayers. Try to understand what is within my control and what is not within my control. So let's classify it into these two parts. I'm going to focus only on things which are within my control and then leave the other part alone. Because if I get distracted with the other part, my brain is going to be very, very messy. I'll be confused. I will have negative energy. So these are some of the coping mechanisms I can think of. Maintain a positive attitude throughout the day, maintain the same structure, same work hours, wake up at the same time, go to bed same time. Now, you know, adolescents have this habit, which is not healthy. They are up till 2 a.m., 3 a.m., 4 a.m. And then the next day, they are sleeping till 2 p.m. This is not healthy. This is going to hurt them. We are going to encourage them not to do that. They do it even on the weekends, on routine days. So this is not positive. Let's work on that habit. And I mean, we can do baking, cooking, hobbies, which we have forgotten. Let's recall our hobbies. Let's recondition our hobbies, get involved. If you have pictures sitting here and there, put them in the album. Let's rearrange our photo album. I mean, chores of these types could help us a lot. I know there's
look into positive
exactly.
behavior.
Yeah.
So in wrapping up, just kind of schedule yourself, not keep your mind empty. You want to do something, schedule activity, learn something new. This is a time, an opportunity to utilize positive thinking, be grateful. So that's excellent, very good. And you know, we all are in this together, and hopefully humanity has seen a lot of pandemics, and I believe this is no different than the others, and we will all get through it. It's been a long time. Our chat has gone over 30 minutes. But it was great. Dr. Shahid Hasnain, as a pediatrician in the area. I believe you're also doing online and telemedicine. So a lot of issues you would encourage that parent not to bring the child if they can be managed. Any last words?
Yeah, last word is about domestic violence. Please don't be shy. If you are a victim of domestic violence, then there is a toll-free number I'm going to share with all of you. It is 800-799-7233. I'm going to repeat, 800-799-7233. If you are a victim of domestic abuse or domestic violence, please call this number. Do not ignore yourself. You are very important. Thank you, Dr. Lalani, for spending this valuable time discussing very fruitful topics and aspects of lockdown and COVID-19. I enjoyed talking to you.
Thank you, Dr. Hasnain. It was our pleasure. And family as a unit, the adults, the elderly, the child, everybody matters. And we just, as you said, we have to be together. We are all in it together, and we will get out of it together. Thank you so much. God bless.
You have a blessed day.